I'm Dr. Bill here for a Sneeze Medical Minute on whooping cough. Whooping cough is actually caused by a bacteria known as pertussis. It's spread by respiratory droplets, and most people, if they've been exposed within 7 to 10 days, they will start coughing themselves. How does it typically present? Well, it is commonly known as the 100-day cough. In fact, that's all the old-timey doctors used to call it, the 100-day cough, because it would last that long. The first phase begins typically like any other cough or cold a person might get in the wintertime, except for this. Most cough and colds will peak at about 7 days and then get better as you roll towards 2 weeks. With pertussis, it's the opposite. It actually begins, and at a week it's still bad, and then at 2 weeks it's a little bit worse, and by 3 weeks it's significantly worse, and a person is heading into the next phase of the cough. That is the phase where the cough actually gets its name, the big whoop, and here's why. In that phase, kids will cough and cough and cough, and instead of taking a breath in and coughing some more, they will just keep coughing. It is stunning to watch. They will go cough, 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 for up to 30 seconds or a minute, and then finally, when they are absolutely out of air, they will take a giant breath in like and that gives us its name, the whooping cough, because that was very characteristic of sort of elementary, middle school age children when they have it. Not everyone does that. Older adults don't always do that. Young infants don't always do that, but that's the classic part of that phase and where it gets its name. The third phase is really what we would call the convalescent phase, where people gradually get better over the last month or two. Now, what can you do about it? Well, there's several things. First, get the vaccine. There's a vaccine actually that people began getting as infants, 2, 4, 6 months. Also, we get boosters for that when we get a tetanus shot. And the reason is that it's very easy to catch pertussis, and our immunity tends to go down a little bit over time. Hand washing is critical to help decrease the spread. And then there's also treatment that's available. There are a couple of antibiotics that work specifically against pertussis. Not all of them do, but several do. And those are the ones that your doctor needs to give you. Tests can be done to confirm whether people have it or not, but most of the time people do it based on the symptoms and the presentation by the patient. Now, why does this really matter? Well, it matters for a couple of reasons. First, pertussis has been on the rise in the United States since the 1990s, so it's way more common than it used to be, which means we have more missed days of school and more missed days of work by parents. The other reason it's really critical to pay attention to whether you have pertussis is this. When infants get pertussis, almost always they land in the hospital, and about 1% of them die, and it is a terrible process. The bacteria called pertussis basically causes all this increased mucus production and the sloughing off of skin cells that line the tubes or the airways that go out to the lungs. And so people literally can't get enough air in. And on infants, where their airways are tiny, some of them in essence suffocate to death. So if you have small children, if you're about to have a baby, or if you're a grandparent or a caretaker, you absolutely need to get that vaccine to keep you from giving it to the baby. I'm Dr. Bill, and that's your Medical Minute on whooping cough.